Hello and welcome back to my channel. My name is Jeanette. And in today's video, I want to talk about part two of the interview process. So in the first video, we talk about you seeing the job and how to sort of prepare and send your resume out. Now, today is the day you've gotten the call and now you're getting ready for that interview. So I say, okay, in the meantime, when you've sent out that resume, now YouTube University is one of the best places to learn. I will go on YouTube and I will start practicing my some questions and answers because you don't know what you're going to be asked. But at least you know there's some generalized questions that is normally asked at interview, strengths, weaknesses, things like that. But it may sound simple, but when you're faced with other people on that day, sometimes it's normal to get scared, and especially that you know that this is something you want, this is a job you want. And sometimes we get tongue tied, you know how it is. So I say, on the day of the interview, I say, make sure you're well groomed. I mean, shower. It may sound simple, but I've had people who come to me and I wonder, did they just roll out of bed and come? Their hair is not groomed. So I say, just get a shower, light makeup. You don't have to have all these blue and glittery eyes because sometimes, I'm not going to lie, I'm like following the person and all I can see is like, the eyes, the colors around them. And after the interview and you sit and you talk, some of these are the things that we actually said, well, why did this happen, or why did she come this way, you know so I say, limit, your the bright makeup. I like something modest like black, blue slacks, dresses, skirts, not too short. I said, don't wear sleeveless, tank tops. Don't wear those. Those are for the beach, you know. I say, even jewelry, just make sure you don't put too much on. Sometimes we had an interview and there's so many like jewelry that keeps banging on the table, while the person is answering because their hands are going up and down and it banging on, on the table. So I always say, bring a small book with you to write anything down. Believe it or not, it looks like you're really interesting when you jot something down. I always take extra resumes with me too, because I know that a lot of these places, they will make copies of your resume and give them to the different persons who are going to attend your job interview. But I always say, bring extra just in case somebody showed up that they were not sure was going to show up. You look so professional that you just give them one. So you sort of, you came prepared. So another thing that I also say is, come with at least two questions. Don't, because you know at the end of the interview they're going to ask you, do you have any questions? And don't say no. Said yes. And then I can give you like two simple things that sometimes I tell people. You can even, to ask, you can say, well, what is your staffing ratio like? Or what is your staffing ratio now? Because you know that they're posting jobs because somebody has left or they just open up a position. So you want to sort of have an idea what you're going into, you know. Another question that I would tell people you can also ask is, maybe personally, if you're really interested in, in the job, what are some of the challenges that they think you may face? Because they have your resume that shows that you worked at this place, you have maybe med surg background, a little bit of pediatric, but no, this is more of a cardiac unit. So there's a learning curve that is involved. So what are some of the challenges that you think that they think that you may experience? And also maybe how are they going to help you? In some places, like when I did oncology, some of the nurses who would come in would not have any portacath, accessing a portacath experience. So what we'll do is that we'll send them to like infusion centers where you do so much accessing of the portacaths so that they feel comfortable doing it. If it's a cardiac flow, you may be expected to maybe do some EKGs. I know some flows they may have the EKG tech who can do that, but we know in this day and age that a lot of times as a nurse, you have to chip in and you have to be everything. So it's wise that you ask them, if I want to learn to do an EKG, can you send me to a class? And one the other thing I tell people too is, if you have plans already, like one time I was interviewing for a position, but I already had a trip to St. Lucia planned for my girl's 50th birthday. I wasn't going to miss it. So I talked about my plan trip, my week off, and I told them, if I get this position, is that something where they'll be able to give me that week off so I can go to that scheduled plan vacation that I had with my friend. And most of the time they're going to say it's okay because they can work around it, and at the end of the day, you actually want this person, you're looking for a good addition to your team. So I said, don't wait until you get in and then you start saying, well, I have this trip plan. To me, lay it out on the table so that they know that you had this plan already. Now, always be honest when they ask a question. One of the questions they love to ask is if you've ever made a mistake. I remember when I was asked that question, and of course, I've made a mistake. And one time I had given a patient 30 milligrams of Toradol because the order had said 30 milligrams of Toradol. But within the order at the bottom, it did say if the patient was more than 65 years old, to give them 15 milligrams. I did not read that little fine line within the order, and I gave 30 milligrams. So I had to go and let my charge nurse and my manager know what I did. And I use that as learning curves too for people. I try to, when I have new nurses, I let them know, read your orders well. So, all of us have made a mistake. So a lot of time that question may come up in an interview. Have you ever made a mistake? Just be honest with what you have done, because you're going in, at least you want them to know that they can trust you when they've added you to your team. So let me just recap again. As I said, be prepared, take some resumes with you, take a little book where you can jot down anything, because they may start giving you information and saying, okay, well, if when you get this job, this is the hours. You want to be able to have that information jotted down. Make sure you take at least 2 questions that you can ask them. Never say you don't have any questions for them. Dress professionally. Leave the sleeveless, leave the extra makeup and the extra bangles at home, and just go prepared. Go to YouTube University and read as much, listen to them videos, and just get yourself prepared. And most of all, just be an honest, smile. They actually want to see that you, I guess, have some sort of sense of humor coming along with the team. So just be courteous, just, smile and answer the questions as honestly as you can. Okay. Until we see each other again, you take care and be blessed and be wise.